One thing that's really important to know after you've had bottom surgery, and this is in the case of a male to female patient or trans feminine patient, is the vast majority of patients, and certainly most of the techniques we use here in the United States, leave behind the prostate. So you will always have a prostate. It will be small. This is because of the effects of the hormones and lack of testosterone. But girls need to know that they have a prostate for two reasons. So number one, probably the most common reason you need to know, is that if you get a urinary tract infection, which is a lot more likely after bottom surgery than before, and we think this is because urethra, where you pee from, is a lot shorter than it was before. And so if you do get a urinary tract infection, a doctor who is not familiar with your anatomy might prescribe you just 3 days of antibiotics for what we call simple cystitis, or an infection of the bladder. And what you need to know is, because there's a prostate involved there, which can also be infected too, usually a longer course of antibiotics are recommended. So at least 7 to 10 days are going to be required. So it is important, if you see a doctor that's unfamiliar with your anatomy, to remind them that you do still have a prostate. And then the second reason, which usually only comes into play much later in life, is that if you have it, you gotta have it checked. So that means there is still prostate tissue there, and the usual recommendations on what is required to take care of a prostate apply. Unlike in a cisgender man, or a patient who's had no bottom surgery, the examination is usually done through the new vagina rather than through the rectum, but you do need to know that Miss Prostate is still there.